Ebola is one of the deadliest viruses known to man.
Ebola is not spread through the air like the flu.
A top German virologist has caused shock waves.
Ebola is aggressive hemorrhagic fever syndrome. Ebola in particular causes the walls of the capillaries to slightly separate.
Ebola, do you think that's real?
No.
Infectious disease.
I don't really know what Ebola is.
It started in Africa, and then there's some sort of outbreak. It wasn't contained as well as it should have been. It got into the States. I think people are blowing it out of proportion. It's not too big of a deal because I know that it doesn't spread that well. It takes a lot to actually spread Ebola because you have to come in contact with their bodily fluid.
News, things you hear from other people, sometimes reports that you come across, stuff like that.
BBC World News.
Online.
I am, yeah. I don't want that. Like, I don't want it. I really don't want it.
Yes, very scared. Why? Because I know that if it comes in contact in Canada, it could be really bad and I could die.
I just think it's very unlikely for me to ever get Ebola.
Let's talk about Ebola. Ebola has 3 unique stages. First, there is the early stage, which occurs between 0 to 5 days, and the patient typically has signs of fever, exhaustion, headaches, hiccups, and stomach pain. Next, there's the middle stage, which occurs approximately 5 days later. The patient typically experiences instances of vomiting and diarrhea. And finally, there's the late stage, in which the patient has bleeding from the eyes and eventually dies. Symptoms caused by the Ebola virus can be attributed to the infection of its target cells. Infection of monocytes and macrophages can lead to the production of pro-inflammatory cytokines, while infection of the endothelial cells can lead to a loss of vascular integrity. Both pro-inflammatory cytokines and compromised vascular integrity can lead to multiple internal hemorrhages and blood vessel collapse.
The disease is caused by the Ebola virus. In 1976, 2 distinct Ebola viruses first broke out simultaneously in Sudan and what is now known as the Democratic Republic of the Congo. Its natural host is still unknown, but it's most likely to be the fruit bat. The virus was thought to enter the human population through contact with infected animals and bushmeat. In 1976, the first cases of the Ebola virus appeared simultaneously in Nizara, Sudan, and Yambuku, Democratic Republic of Congo. The disease spread mainly through close personal contact and the use of contaminated needles within hospitals. The reported number of deaths were 53% in Nizara and 88% in Yambuku of the infected respectively.
The Ebola virus is definitely on the rise with no signs of slowing down. Just to put things in perspective, from between 1976, when the first Ebola virus was detected, to 2013, only 1,716 deaths have been associated with the virus. In 2014 alone, there have been 13,567 suspected cases and 4,922 deaths thus far. The doubling time is running at about 25 to 28 days, which means that if there are 10,000 cases today, then by the next month there would have been 20,000 cases. Hot spots include Liberia, Guinea, and Sierra Leone. Currently, there is no FDA-approved vaccine or medicine available for Ebola patients. There are only supportive options such as giving intravenous fluids and breathing support to maintain blood pressure and oxygen levels, which are crucial to the survival of patients. There are also a few experimental drugs and vaccines being tested, which are currently in phase 1 clinical trials. Patient recovery also depends on effective supportive care and the patient's immune response. If they recover, they develop antibodies lasting for at least 10 years. Prevention relies on early and refined diagnostic measures and immediate and enhanced isolation practices. As well, people are encouraged to avoid contact with bodily fluids of Ebola patients and with bushmeat.
In August 2014, the World Health Organization declared Ebola an international public health emergency. By September, UN members began contributing billions of dollars to the fight against the epidemic. Several countries, among them Canada, have put in measures to protect their populations from Ebola, including travel warnings and visa denial. So the question is this a necessary precaution or an overreaction?